Artificial Intelligence Doctor, www.abcpharma.net/English. User question. In a cohort of 70-year-old patients with continuous apical pacing, what factors influence the variability in the time to heart failure onset? And can these factors be used to predict individual risk? COD AI answer. This is an excellent and clinically relevant question. To address it comprehensively, we need to consider multiple factors that could influence the variability in time to heart failure onset in this specific population. Here's an analysis of the key aspects. Factors influencing variability in time to heart failure onset. Baseline cardiac function. Pre-existing left ventricular ejection fraction, LVEF. Presence of diastolic dysfunction. Prior history of heart failure or myocardial infarction. Comorbidities. Hypertension. Diabetes mellitus. Coronary artery disease. Chronic kidney disease. Obesity. Genetic factors. Polymorphisms in genes related to cardiac remodeling. Family history of cardiomyopathy. Pacing parameters. Percentage of ventricular pacing. Pacing rate and programming, e.g., rate response settings. AV interval optimization in dual-chamber systems. Electrophysiological factors. Presence of underlying conduction disorders, e.g., LBBB. QRS duration with pacing. Structural heart characteristics. Left ventricular mass and geometry. Degree of myocardial fibrosis, assessed by imaging. Biomarkers. Baseline and trending levels of NT-proBNP or BNP. Markers of inflammation, e.g., C-reactive protein. Markers of myocardial stress or injury, e.g., troponin. Lifestyle factors. Physical activity levels. Dietary habits. Smoking status. Medication use. Use of cardioprotective medications, e.g., ACE inhibitors, beta blockers. Adherence to prescribed medications. Sex differences. Potential variations in susceptibility between males and females. Predicting individual risk. To use these factors for predicting individual risk, a multifaceted approach would be necessary. Develop a risk score. Create a weighted scoring system based on the most significant predictors. Validate the score in a large, diverse cohort of patients. Machine learning models. Utilize advanced algorithms to identify complex patterns and interactions among risk factors. Incorporate longitudinal data to improve prediction accuracy over time. Imaging-based prediction. Develop models that incorporate baseline and follow-up cardiac imaging parameters. Use advanced imaging techniques, e.g., strain imaging, T1 mapping, to detect early signs of remodeling. Biomarker panels. Create a panel of biomarkers that, when combined, offer improved predictive value. Include both established, e.g., NT-proBNP, and novel biomarkers. Genetic risk profiling. Identify genetic markers associated with increased susceptibility to pacing-induced cardiomyopathy. Integrate genetic data with clinical and imaging parameters for personalized risk assessment. Continuous monitoring. Utilize data from implanted devices to track changes in pacing parameters, heart rate variability, and other metrics. Incorporate wearable technology data for more comprehensive monitoring. Research approach. To address this question comprehensively, a multi-center, prospective cohort study would be ideal. Enroll a large cohort of 70-year-old patients at the time of pacemaker implantation. Collect comprehensive baseline data, including all potential risk factors. Perform regular follow-ups with standardized assessments, clinical, imaging, biomarkers. Define clear endpoints for heart failure onset. Use advanced statistical methods to analyze the data and develop predictive models. Validate the models in an independent cohort. Challenges and considerations. The heterogeneity of the elderly population may complicate risk stratification. The interplay between aging-related changes and pacing-induced changes can be complex. The definition of heart failure onset needs to be clearly established and consistently applied. Ethical considerations in identifying high-risk individuals and potential interventions. By addressing these factors and developing sophisticated predictive models, clinicians could potentially identify high-risk individuals early, allowing for more personalized monitoring and interventions to delay or prevent heart failure onset in this vulnerable population.